Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, this program focuses on different healthcare issues, services, and programs here at KRMC. I've got a great guest on the program today, so stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Kristin Whitehead. Thanks for being on the show, Kristin.
You're welcome.
So you're an ER nurse.
Yes.
That's a major position. I don't envy you that. You're like the front line of defense, the first ones that patients see when they come in.
Right.
That's got to have highs and lows.
It does. It has many highs and lows.
Yes.
Very quick paced.
Yes, yeah. That's the other part of it. Boy, your days must go pretty fast.
Sometimes, yes, they do.
So how long have you been doing that, working as in ER?
I have been a nurse for 16 years, but I've been in the ER for 13 years.
Wow, that's a long time.
Yes.
That is to be dealing with that, because that's a lot of stress too, right?
It is. It is.
I mean, like you said, we see them all. I've been in the ER for the PR side of it, helping like when we've had bus accidents and things like that. And you guys are amazing.
Thank you.
You hold
I
it
think
up.
we are.
Yeah, you are. Well, I mean, and there's that whole team approach. That
It is.
really cool, that because there's so many facets of a patient coming into the emergency room. What else, like, so a patient comes in to the ER, what's the first thing that happens for them?
The first thing that happens is they actually get triaged.
Okay.
And that's kind of to help us see where the flow needs to go. How acute are they? How bad are they? Or are they going to be okay if they waited a little while? That includes vital signs, their just a quick assessment, and their past history, medications.
Okay.
But like you said, the team approach is what works, because all of that gets done very quickly.
And so if it's very serious, obviously, they're going to kind of go to the head of the line, if you would, versus
Yes.
someone with an earache or sore throat.
Yes.
Which might be frustrating to that person. But if someone's bleeding, obviously they're, right?
Right. And patients are seen based upon their acuity, how
Okay.
sick they are compared to if they can wait.
Right, right.
So,
Well, and people have to realize that obviously if it's an accident victim coming in by ambulance, they're going to get moved up. But for the most part, I mean, we have a kind of a time frame you work within. Isn't there a goal that you've set in the ER? How soon?
we have many goals.
Okay. Let's hear them.
One of the biggest ones is from when you walk in the door to how long it takes to get triaged, and that's usually less than 5 minutes that we
Wow.
would like. Doesn't always go accordingly,
Sure,
especially
depends.
when everybody comes in all at once.
Right.
We would like our patients to be seen in less than 20 minutes by our physicians.
Okay,
Because
so
of
that's
course
from
they're
the-
there to see the doctor.
Right, so from the time they come in, then 20 minutes before they see a doc?
Yes.
That's pretty good too.
Right. We do have many doctors throughout the day, and that has helped tremendously, having more physicians on staff.
Okay.
So that has increased our time. But then again, like you said, the mass casualty incidents, we have something major going on, we can get tied up, and then, our goals are not what we would like them to be, but we really shoot for them. And most of the time, we actually are right on.
And you've had a busy winter. I know this past winter when we had such a high flu season.
We have. It's record days, not only for the hospital, but for the ER.
Right.
We saw over 4,700 patients in January.
In 1 month?
In 1 month.
Oh my goodness.
Yes.
That's a lot of people.
That
or a lot of,
is.
yeah.
Yeah. And running through our little 28-bed ER, when you see 180 patients a day, that's huge.
That is, because
So.
when the patient comes in, like I said, they're triaged, they see a doc, and then most of the time the doctors are going to ask for whether it's lab work, x-rays, right?
Right.
What else? What other
Lab
things?
work, x-rays, medications that they may need.
Okay.
Just
All
many
of those
factors.
Things that help in diagnosing.
Correct, yes.
Figure out what's wrong.
And our expectation is to have a turnaround time of about an hour after you have a test done to have those results.
Oh, that's pretty good too, so you're not
So,
waiting forever
Of course, when you have record days, that goes up
Right.
a couple hours.
Yes,
but
when you've got 180, is that what you said, in one day?
Oh, yeah, actually, our that 183, I think it was our record.
Was your peak?
Was our peak.
My
Yes.
goodness, that's a lot of people. And was most of it like acute flu type of thing in that?
Yeah, we actually saw a lot of flu, a lot of pneumonia. Our RSV season was one of the highest we've seen probably since I've worked here in the past 10 years.
Wow. So you've been at KMC 10 years, is that?
I've been here 11.
11, okay.
In November it'll make 12.
All right, very good. So where did you do nursing before KMC?
Up in Las Vegas.
Oh,
yes.
and then you moved to Kingman?
Yeah, my family is here.
Oh, that's nice. Okay.
So yeah, and just where I met my husband, coming down to visit. So I moved back here to home.
So you're from Kingman originally?
I'm from Kingman originally.
Oh, how cool.
Yes.
That's not a lot of that anymore. There's a lot of people that have moved here, but not somebody that, were you actually born here? Or
No, I was actually born in Flagstaff. We moved
Okay.
here when I was almost 2.
Well, so
close.
you pretty much just know Kingman.
My whole
That's cool.
life.
So you went through the whole the Kingman Unified School District? And
Except for high school. We moved to Las Vegas when I was in high school.
Oh, okay.
And then I went on to UNLV, and that's where I got my nursing degree.
nursing degree. Okay. And then you came back to Kingman. That's
did.
That's very good.
Yeah.
So you're married and have children?
I'm married. I have 2 children, one who is 11 and another one 19.
Oh my goodness. I
I
wouldn't have
know.
guessed that, huh? How do they grow up that fast?
I know, and he's getting ready to go into the Navy.
Oh,
so,
very good.
So we're going to have half empty nest syndrome.
Yeah.
It's kind of
Oh.
weird.
Yeah, that's hard letting them when they go.
It is.
Navy's a good career though. My husband was 21 years Navy, so
Oh,
that's good.
yes.
Very
Yeah.
good. So you've been in here at KMC in 11 years. But there's been lots of changes in the past 11 years. Here at
Many
KMC.
changes, yes.
So what do you think is the biggest change or the most important change you've seen in the ER during that time?
In the ER, one of the things is that we just keep expanding to try and help our community because of the size. You know, bringing on more nurses, of course, that is great because ER nurses can't say no to we don't have a patient-nurse ratio.
Oh, it's just however many is
Just
there.
how many's there, and that's how many you take.
Yeah.
And of course, the team approach. If you have a very sick patient, then the rest of your team takes over the rest of your patients.
Oh, okay.
But yeah, just the amount of nurses that we have to be able to control the flow and get patients through there and just make it a safer environment.
And that's
It's-
important too, obviously.
It is. It really is. I went from when I first started there. At one time, I could have anywhere from 5 to 12 patients.
Wow, that's a big
and
spread.
now having 5 patients is like, okay, we can handle this. You know.
So it's more like 1-to-1 almost? Or?
No, it's not 1-to-1. We still, because we keep expanding the amount of rooms, of course we need more nurses.
Sure.
So, and then we have desk beds, hall beds. I mean, when you say 28 beds, we probably have the capability of 38 to 40 in the emergency room at
If
any
you
time.
had them in the halls.
Yeah, we do.
Well, I know like when we had that bus accident
Right.
last fall, I think that was, and you know, they were in the halls and sitting on beds in the different areas and just whatever we needed to do. And then the walking that were okay, we had them in the cafeteria. So whatever need.
Yeah, we do have a mass disaster plan set
Right.
up, which is nice.
Yeah.
So.
And hopefully we don't have to use it very often. but-
Exactly, but with all the tourists coming around
Yeah.
and we're the IT hospital,
Yeah.
you know, you're right smack dab in the middle of nowhere.
Yep. And there's a freeway that people
Yeah,
just
freeway
keep
what
having
runs right
accidents,
through, you know,
right?
to Phoenix, Las Vegas, Salt
Yeah.
Lake,
Yep.
you know, going the opposite way.
Yeah, so there's lots of cars going through here and lots of accidents. So you see a lot of that type of injuries, right?
We
in
do.
The ER.
We do.
I know that we've had residents on the program before, or doctors from there that have talked about that. One of the reasons that they like training here is because there's such a broad range.
And
in the
there
ER.
is, there really is. I mean, I came from Las Vegas where you had this huge community and we rarely ever saw a trauma because there's a trauma center.
Right.
And then you come here and you see everything. And I have done more than I probably would ever get to experience
Oh, wow.
at my last hospital and learn. You know,
Right.
it's been actually
a
a
lot.
great experience.
Well, that's good. I'm glad to hear that. That's cool.
Yeah.
So nurses are amazing. I almost said amazing creatures, but
Well,
Amazing
that's not
people.
far off.
but you're amazing people because you have to be compassionate, but at the same time, you got to stay kind of detached. Can't panic, right? Blood can't turn you off.
Right, right.
So what brought you into nursing? I mean, because that's a big commitment.
It is, and I don't know why. I've actually I have the usual answer that I've always wanted to be a nurse.
Okay, since
My
you're a
whole
little
life,
girl.
since I was a little girl,
Oh,
I've
cool.
known what I was going to do.
Yeah.
Went straight through to college and became a nurse.
And you never had any time during that training or since then that you go, oh my gosh, what have I done?
No. What's really nice about nursing is there's such a variety. I mean,
That's true.
When I got burnt out on ER the first time, I went to the cath lab and gained major cardiac experience, and that was
Awesome.
wonderful. And just knowing that you can take a break and go
go to
elsewhere.
different.
The community nursing, the school nursing,
That's true.
you can sit at a desk and do things. That it's not just one thing. You don't have to pound cement for 12 hours.
Right.
If you
Yeah,
don't want
that's
to.
the other thing. Your feet you must have strong feet. You're on your feet all day long.
Shoes.
So good
Shoes are the key.
Okay, good shoes, yeah.
And change them often. I probably go through a pair of shoes about every 3 months.
Oh, so almost like a runner, which is basically kind of what you're doing, right? Running
Yes.
on your feet all day long. Amazing. So what other we talked about the team approach, and I don't mean to jump around so much, but I
okay.
keep thinking of when you're talking about the team approach, who all do you consider part of the ER team?
Everyone, actually. Really, from our attending physicians to our residents, you have the nurses, you have all the nurses, and then we have CNAs, we have ER techs who are paramedics out in the field that bring a lot of experience and a lot of knowledge and skill with them. But X-ray, and we're talking CT, regular X-ray, phlebotomists. Without them, you can't do your job. So everybody
True, yeah.
jumps in. There'll be times where you have to hold somebody's arm because they'll stop, to start an IV, and it won't be another nurse or what you consider nursing personnel. It's one of your phlebotomists. It's one of your X-ray techs helping you out.
Okay.
So
They kind of step in where they're
they
needed.
do. So we really have good relations with them, and without them, you couldn't have an ER.
Right.
So.
Well, and I know we talked briefly about your goals, and I know patient satisfaction obviously is very important in the ER as well. And again, that's got to be a fine balance between providing the care
It is.
quickly.
It is. Because when you think emergency nursing, you think airway, breathing, circulation. Once you have those, then your patient's going to be okay. And it's hard to gear away from that and think, okay, now we need to take care of the other things that are a lot of concerning to patients. We had to actually relearn some of it and go, hey, they don't care that this person doesn't have an airway. They're in pain, or
Right.
they need to go to the bathroom because you just put a whole bunch of fluid in them and they're about ready, and you've hooked them up to all these monitors.
So they can't get up by themselves.
Yeah, and it's actually just the little things, and we're like, okay, and it's helped tremendously to kind of help incorporate that. And then again, having the extra staff
Right.
is such a plus.
Okay, yeah,
So.
that's good. Yeah, you need more hands, obviously. to
We
get-
do. The more hands, the better, and
Right.
and it's great.
So part of, like we said, nurses are amazing people, and we have them throughout the hospital in all different aspects. And we're getting ready to start celebrating them in the month of May,
Yeah.
but specifically for Nurses Week. When is that? Do you know when it starts?
It is. It starts on May 6th, and
Okay.
then we'll finish on May 10th.
Okay, that's cool. And I know there's a whole bunch of things planned during that week, and we want to make sure we're going to fill the audience in on some of those things that we're planning, because we want to get the community involved too, and it's an opportunity for them to say thank you, and let them know that if they know a nurse, pat them on the back, right?
Right.
Tell them thank you. I
Yeah.
know. It's part of the time for the hospital to say thank you to our nursing staff as well. So we're going to take a quick break, and then when we come back, we'll talk about Nurses Week, okay?
Okay.
So we'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Kristin Whitehead. Thanks again for being on the show, Kristin.
You're welcome.
So we were talking before the break, the importance of the ER nurse and your team and all of that. But then we kind of segued into what's coming up here in May, Nurses Week.
Yes.
And that's it's a special time for the nurses, for the hospital to say thank you. But I think I want my audience to know about it too, because then they can say thank you to their friends or family, neighbors that are nurses. So what are we doing for Nurses Week?
Well, it's always something a little bit different each time, and we actually kind of look forward to it.
Good.
Which is really nice. It's nice to have the whole week of recognition.
Right.
So May 6th through 10th. One of the things is not everybody works Monday through Friday.
Sure. Yeah.
So they actually try and do something special every single day for us.
That's good.
Even if it's just something, they'll bring in cotton candy
Okay.
one day. Another day they'll have like a little ice cream social for us.
Oh, good.
Add popcorn. We usually get a small little gift. But one of the best days is Friday to be here.
Okay.
Because then we actually have like this whole gathering of nurses from all over, and you get to see the people and feel as one. And you have doctors speak about nurses and nursing, and then other people. And then one of the really nice things is we actually have a pastor come out, and he'll actually bless the hands of the nurses.
Oh.
And
I just got goosebumps late.
and it is, and it feels special. You don't have to participate in anything unless you want to. And by the end of the week, you're just kind of regenerated, and you've
That's good.
reconnected with all the nurses in the hospital. It's not just your specific department. And everybody's together and as one again, and it's really nice and cohesive.
That's great. And I know they're working, I believe that Mayor Salem is going to do a proclamation for Nurses Week. Did you know that?
I had heard he was going to be there, but I didn't know about the
Yeah, I think
proclamation.
they've got something working on that we're going to put that out for the city, to proclaim it's Nurses Week and Nurses Day. So that'll be cool. And that I know that blessing of the hands is a real special ceremony that they do. I think, don't you repeat the Florence Nightingale pledge or something like that?
That's part of the whole Friday thing,
Okay.
and then the blessing of the hands is something different.
Okay.
And it's just you and the pastor at the
Okay.
time, and he gives you a special blessing just for you.
That's awesome, because that is, your hands touch and heal an awful lot of people.
Right.
That's amazing, and it does take a very special person to be a nurse, and then even more in the ER side of it, as we talked about. We were talking before the break, too, about the different levels of nursing or different parts of nursing, because we have nurses on every floor,
Right.
ICU, PCU, med-surg, pediatrics, and they all kind of have their little niches. But I think sometimes people don't realize when they come into the emergency room and they have to be admitted, when the doctor says we're going to admit you, they just think, whoop, up to the floor I go. But it doesn't happen quite like that.
It doesn't. It really depends upon capacity, because we try and staff for the amount of people that are in there. So it actually goes through a process where we actually, a nursing supervisor or somebody who actually works on bed requests, runs the whole ticking of the hospital.
Wow.
And you ask for a certain kind of bed, and then they see what's available and make sure that it's ready. And sometimes they're not. Sometimes we have to wait for people to get discharged to get that bed. And then once they're discharged, the
Gotta
rooms
clean
have
the
to be
room, of
clean.
course.
And that nurse has to be ready to take the patient, and then we can finally get them upstairs.
Okay. So do you have like a goal for how long that's supposed to take?
Our goal is usually less than an hour from when we request to actually get the bed assigned that we need. And then after that, once it is ready, the nurse is ready, the bed is ready, we have 30 minutes after that to be able to get the patient upstairs.
Okay. Yeah.
So it
And of
is
course
a bit of a process.
Right,
but
and like you said, depending on how full the hospital is and how busy the ER is, it can take longer. Sometimes we have to be patient as a patient. Patients have to have patience, right?
And it's tough because, I mean, our beds are like bricks. You
Right,
know, you
yeah.
have this tiny little mattress. I wouldn't want to be on there for hours on end either. I mean,
Well, that's a good way
and
to
I
keep
have been
people
a
out of-
patient
Oh,
on
so
the
you've
other
seen it
end,
firsthand?
so seen it firsthand. So, and it gives you a little bit of respect, but then you're, to see the other side.
Sure.
So.
Well, and I know that you guys also work closely with the family to try and keep communicating with them as to what's going on with the patient, because sometimes you'll have a whole crew waiting in the waiting room, right?
Right, right, and it is rough because space is limited, and when we all want, the team wants to get in there, we want to get everything done quickly, efficiently, and we'd love to have the family there, but sometimes we
There's
make
just
them
not
wait.
room. Yeah.
And 15 minutes is enough for us to get in and get most everything done.
Yeah.
And then we let the family back and communicate with them and try and keep them up to date.
One of the
So-
things you mentioned too is that some of the improvements we've done in the ER room, you talked about adding a TV. Now, what is that? What's so great about that?
Being a patient, the ER is boring.
Right.
And you're just sitting there waiting, thinking in your mind, what's happening, what's
Yeah.
going on with me? And it's something to pass the time, I mean, having the station, and they're right there. They pull around right in front of the patient.
It's kind of like almost like a dentist office where it pulls around.
Yeah, I mean,
up along
it's
there.
either that or sit there and watch all the people run around,
Although
which is
sometimes that kind of be.
right. I do, in fact, when I put people in the hallway, sometimes I say, well, you might get a floor show, by accident. We don't mean to. We like everybody to have their privacy,
Right.
but, you got to do
Sometimes.
what you got to do
Yeah.
sometimes. Yeah.
It's too
So,
much fun.
yeah, when they finally put the TVs in, it was huge because, then the patients are happier and they're not always going, what's going on, what's going on,
Yeah.
what's going on? And, not that we don't try and keep them updated.
But it's still, that helps, like you said, to kind
It
of
does.
pass that
And
time
especially
a
with
little
children too.
Oh, yeah.
Something. Oh, especially, you get a sick kid in, they start to feel better and they want to run around the ER and they can't. That's
bit.
hard.
No, yeah, that's not
And
good.
it's hard on the parents.
Sure.
So.
Now, we talked too about the different levels of trauma. Can
Mm-hmm.
we explain that to so is level 5 the lowest or the easiest? How do you describe that?
Well, they have the different levels of trauma centers.
Okay.
Traumas, when we actually announce them overhead, are a little different too.
Okay.
But they have 1 through 5, and 1 is the highest level trauma center that you can have, and that means that they are fully equipped to take any trauma at any time. They don't have to call in any physicians. They have them right there in house. They have a specific trauma team.
Those have got to be
And
kind of few and far between, even in the big city, right?
They are. The level 1s are, there's 1 in Las Vegas, and I believe there's 2 in Phoenix.
Okay.
There's 1 in Tucson. So that's
Okay.
how scattered they are.
All right.
Level 2, of course, is not a level 1. They have a little bit differences just in the services they provide.
Okay.
We're actually a level 4 here in Kingman, and it means that we have a program set up to be able to take trauma patients. We have requirements that we've had to meet. One of the big ones is a trauma training for all of our nurses in the ER, specific trauma training. And then we also have to require trauma training for part of the PCU, ICU, and CVICU nurses along with surgery.
Because the patients are coming from ER up to
Right, and they're
those
going to those
floors.
specific places.
Okay.
So we're actually able to keep a lot of our traumas that we weren't able to. We don't have to fly every single one
And
out.
that's really important for
Right.
family.
Having a trauma surgeon on call, which is not always 24/7, 7 days a week, and that's what differentiates us with us, is getting a lot of the people on board and getting the services that we need.
Because you have to be able to provide that.
Right, and
24/7.
we'll be able to have these trauma surgeons come into our room and perform a lot of these things that we used to fly people out for.
Okay.
And that has been great.
Sure,
So
yeah,
we
'cause
can
that's-
treat our patients right there and not have to go, I wish.
Right.
Now we say I can't.
Oh, that's awesome. So
Mm-hmm.
what kind of those types of traumas are we talking mostly? Because I know head trauma we still.
Yeah,
'Cause
we
you don't have a
we don't have
neurologist.
the neurologist. We do have the Mayo program,
That's right,
but not
yeah,
for
so-
head trauma,
Right.
but for strokes.
Right.
But some of the things that we can do is people who used to have like ruptured spleens, if we didn't have a surgeon capable of that, we'd have to fly them out. And then, the 40 minutes it takes to get to Las Vegas could,
Yeah.
it make or break that person.
wow.
They could live or die. Now our doctors can take them.
That's awesome. And
Yeah.
I'm so glad to hear that. And we're out of time already. See, I told
That's
you it was going
okay.
to go really fast. And now we're just getting excited and into stuff.
Yeah,
and
that's all right.
Time's up. But thank you for being on the program
You're welcome.
today.
Thank you for having me.
If you know a nurse, tell her thank you. Appreciate her for what she does. I hope you'll join me again next week. I'll have another great guest on the program.